So now I'm going to talk about the complications of the neonates having delivered prematurely. Premature. The definitions of premature is the baby is delivered at birth below than 37 weeks of gestations. The lower of the gestation, the higher the incidence of the complications of the complications of all the systems towards the baby. Why is that so? This is because of all the organs are not mature yet, so they are vulnerable, and because of all of this they develop a lot of complications. So there are few complications involving multiple systems. For example, is cardiovascular system. This usually the babies always presented with patent ductus arteriosus. This is the condition in which the ductus arteriosus does not close. The ductus arteriosus is where the pulmonary artery and aorta is connected. Usually during premature delivery, the ASD is the septum of the atrial is not closed, so these are balanced. But when they deliver, usually the septum of the atrium is closed, and if the PDA is large enough, this will cause a lot of problems, such as heart failure, and usually they presented with poor feeding and prolonged feeding interval time. What about the and then usually the babies presented with respiratory distress syndrome, the conditions where the baby had a respiratory distress, evidenced by tachypnea as well as use of the accessory muscle such as subcostal, intercostal, and suprasternal muscle. So all these muscles used to increase the ventilations of the baby. The reason that they have a respiratory distress syndrome because of the premature lung, because of hyaline of the surfactant. Hyaline surfactant is not developed yet. Usually if there's indication that the baby is going to be delivered below the gestational below the supposed to be gestational age, below than 37s, so the doctors such as obstetricians will give dexamethasones to promote lung maturity. Dexamethasone only works 48 hours maximally, effect 48 hours after after the first dose, and usually it takes effect for about 7 days. So even though even though we give the dexamethasone, we still have the incidence of respiratory distress syndrome, and compare when we are not giving it, the incidence of after giving the dexamethasone of the incidence of RDS after giving the dexamethasone is much lower. So for this, we need to give a surfactant for this baby. Usually they had respiratory distress for about more than continuously for 24 hours. So we need to ventilate the babies. The other system is central nervous system, whereby the babies might have intraventricular hemorrhage, the hemorrhagic in the ventricular area. This is because of the germinal matrix is vulnerable in the ependymal areas. So you need to know the anatomy of the ventricular, and if severe enough, the hemorrhagic, it cause dilatation of the ventricular, and to the stage at the most severe, this will extend it to the periventricular area. So the risk for having damage of the brain itself is higher, and this may result of cerebral palsy, the condition where several non-progressive brain development because of the damage, and usually involve the motor problem. Okay, what else? In GIT system, they were presented with necrotizing anthrocolitis, the conditions where the bowels having ischemic, probably due to the attack of the pathogens, the common cells in the common cell itself in the gut. Okay, because the immune system is not strong, so the common cells in the GIT will predominantly attack the immune system. So usually this will cause what we are afraid is perforations, and what they are need to do is they are usually doing stoma or anastomosis of the gut, and if it's extensive enough of the cutting of the sections, this will cause a short gut syndrome. Okay, so these are the complications based on the main systems involved. So we need to take it more. We need to have the expectations for this baby to develop all these symptoms. So the thorough examinations for all the systems are necessary, so to reduce the mortality of the baby. Other things is they may have birth trauma because they are vulnerable, can cause bruising, can cause fracture and nerve damage. They also can have hypothermia, so we need to incubate the patient in a good temperature. Okay, that's it.